About 84% of people experience low back pain in their life. That's a pretty alarming stat. Not only is low back pain very common, but it plays a huge role in the quality of your life. Simple things such as putting your shoes on or getting in and out of bed can be very painful with low back pain. And if you regularly exercise, it can play a huge part of the progress you're making at the gym. And the other thing that freaking sucks about low back pain is that there are so many causes of low back pain. Even a little thing such as stress can be a cause of low back pain. This leaves a lot of people with low back pain feeling confused and upset. While I have never experienced chronic back pain in my life, I have treated patients with the supervision of a physical therapist who had low back pain. And for those of you who don't really know me, this is because I was in physical therapy school and I had to treat patients in my clinical rotation. While treating these patients, I noticed certain things that typically make a big impact on low back pain. As I mentioned earlier, there are multiple causes of low back pain, but I noticed that specific exercises consistently help with the patient's progress. Because I'm here to make fitness great again, I'll be showing you exercises that you can do at home. That's right, at home, to help with your low back pain. And because you can do these exercises at home, you have no excuse not to do them. Before I get started with the exercises, I feel like it's my responsibility to let you know that I'm not a licensed physical therapist, and if you are experiencing low back pain, I would always recommend that you see a professional. But I understand that medical treatment can be very expensive, so I'm here to give you exercises that you can do for free. Also, if you're looking for athletic bodybuilding programs to build your dream athletic physique, my brother and I just released our Ultimate Athletic Bodybuilding Academy, where not only do you get a push-pull leg splits every month, but you also get access to me and him directly. If you're interested, I'll leave a link in the description. The first thing I noticed that made a big impact on a patient's low back pain was mobility. When people have low back pain, the first thing they do is do anything they can not to trigger the pain. And most of the time that involves very little movement of the low back. But ironically, this is making their problems worse. So if you're experiencing low back pain, not moving your lower back is leading to more problems. So it's really important for you to get your low back moving with some low back mobility work. There are 3 exercises I really like for low back mobility that will help get your low back moving and help with the pain. The first exercise being a lower trunk rotation. For this exercise, you're going to be on the ground with your knees bent. The goal of the movement is to turn your lower body to the side while keeping your upper body on the ground. And you'll essentially be going back and forth in a windshield wiper-like movement. The second exercise I like are supine marches. You'll be in pretty much the same position as a lower trunk rotation. And just like the name of this exercise, you'll essentially be marching but on your back. The goal of this movement is to get your knee up to your chest as far as possible. And the last exercise I really like is the medicine ball rollout. If you don't have a medicine ball at home, you can just increase the time you do the first 2 exercises, but I included this one because I really like this exercise. For this exercise, you'll just be sitting down with your hand on a medicine ball. And all you'll be doing is staying seated and leaning forward as far as you can. So in this video, my brother is doing the exercise, and because he doesn't have low back pain, he's able to get a ton of range of motion. So don't see this video and think you have to go that far. Just do as much range of motion as you can. And that'll be it for the mobility drills, but unlike most people online, I'll actually give you the doses to do the exercise properly. For best results, you should be doing each exercise 3 to 5 minutes twice per day. I like to use a time frame rather than reps because I feel like reps people usually lose count, and a time frame you can easily just set an alarm on your phone and do the exercise for the specific amount of time. And now on to the intensity. In terms of intensity for the exercises, I feel like people usually fall into 2 categories. They either go way too hard and way too crazy to where the exercise is super painful, or they're not pushing themselves enough to where they're not getting enough range of motion. I would say the best intensity is somewhere in the middle. We should be letting the pain guide you, and we only want a little bit of pain. Go to a range that's tolerable. When performing these exercises, you want a little bit of pain, but not a lot of pain. Second thing I noticed really helped with patients' pain was hip strengthening, and in particular hip flexor and hip abductor strengthening. If you do a typical exercise or bodybuilding routine, you rarely hit these muscles. Common exercises for hip strengthening would be something like a squat or a hip thrust, with both exercises strengthening your hip extensors. And this makes sense because the hip flexors and hip abductors are deep muscles, so bodybuilders don't really care about training those muscles. So these muscles are commonly weak in people, so the goal here is to strengthen our hip flexors and hip abductors. And to start off, we'll start with the hip flexor strengthening exercise. And this exercise will be a single leg raise. For this exercise, you'll be lying on your back with one leg straight and one leg bent. And all you'll be doing is raising that straight leg to roughly the height of the other knee. When doing this exercise, focus on keeping that leg straight. Lots of people will cheat and bend that leg, but we want to keep it straight. Now this exercise looks super easy, but I promise because your hip flexors are likely weak, it's very challenging. A simple way to progress this exercise is to buy some ankle weights. Now into the hip abductor strengthening exercise, and it'll be a side lying leg raise. So you'll be lying on the opposite side of the leg that you're trying to work, and while keeping your leg straight, you raise your leg as high up as you can while lying on your side. And just like the straight leg raise, an easy way to progress this is to add some ankle weights. Now into the dosage for the strengthening exercises. You should be doing about about 3 sets of 10 to 12 reps each session. And just like the mobility exercises, let the pain guide you. A little bit of pain is good, but we don't want a lot of pain. It's best to do these strengthening exercises every other day so you allow these muscles to recover. The third thing I noticed helped a lot of patients with low back pain was hip stretching. Because of daily activities, most people have tight hamstrings and tight abductor. And obviously the goal here is to stretch those muscles and allow for greater hip flexion and hip abduction range of motion. And first I'll start off with the hamstring stretch. There are a lot of hamstring stretches you can do online, but this one in particular is my favorite. I like doing unilateral hamstring stretches as I'm able to focus on one leg and get a better stretch. When I think of stretching, I think of doing the opposite of what the muscle does. So your hamstring flexes your knee and extends your hips. So to stretch a hamstring, you'll be doing the opposite. You'll be extending your knee and flexing your hip. For this exercise, I like to use some sort of platform and then put my foot on it while keeping my knees straight. If you choose to do this hamstring exercise, try and do a better job of keeping your legs straight than I did. I don't do static stretching super often, so my form isn't the greatest, but you get the general idea. Once I'm in that position, I'll slightly lean forward or flex my hip until I feel a light stretch. The second exercise will be a hip adductor stretch, with my favorite being this stretch, which I don't really know what it's called, but I like to think of it as kind of like a frog stretch. I know it looks kind of sus, but I promise you, you get a great stretch of your adductors here. For this stretch, I put my knees as far away from each other as I can, and then I bring my hip towards my heels until I feel a light stretch in my inner thigh. For each stretch, you should be holding for about 30 seconds and do 3 rounds. And for best results, do twice per day, every day. And just like all the other exercises, let pain guide you. You don't need some crazy intense stretch. A light stretch will be enough. And those are all the exercises I would recommend if you have low back pain. But since I'm all about providing value, I'll give you a sample workout of what I would do if I had low back pain. The first thing I would do would be some warm up to get the low back warm. I will go on a bike that allows for lots of range of motion and do it for about 5 to 10 minutes, with this bike being my favorite. If you're doing your exercises at home, it's fine if you don't do this warm up. I would then follow that with low back mobility. If I had access to an exercise ball, I would do lower trunk rotations for 3 minutes, then supine marches for 3 minutes, and then medicine ball rollouts for 3 minutes. But if I didn't have access to an exercise ball, I would just do lower trunk rotations for 5 minutes and do supine marches for 5 minutes. I would then follow that with single leg raises. I'd be doing 10 to 12 reps of 3 sets per leg with about 1 minute rest in between each leg. I would then follow that up with side-lying single leg raises. And the dosage would be the exact same as the single leg raise. I would then end my rehab session with some stretching. I would do 3 rounds of a 30-second hold of my hamstring stretch of choice, and then do the exact same dosage for the hip abductor stretch of my choice. And I would call that an effective low back rehab session. Obviously, the sample workout would be if you're doing hip strengthening that day, but if you weren't doing the strengthening exercises that day, you would just take those strengthening exercises out and do the other exercises twice that day. And that's it for the video. Let me know if you have any questions in the comments, and please like the video if you enjoyed it and subscribe if you want more content like this.